So how do you get there? And how do you kind of get to sample some of this life? And really you've got to decide what you want to get from it, and you need to do your research and speak to people who are there, and preferably if you're going as a fellow, make contact with the current fellow in the unit, make contact with the unit and speak to people about what things actually involve. Decide early on where you want to go and make that clear from the very outset, because what Australian units don't like is people chopping and changing ideas as they go along. And believe it or not, the power of actually visiting the unit and making personal contact is actually pretty exceptional, and that alone makes a lasting difference in terms of your opportunity to get jobs out there. And it's one of the things that whenever I got my job that I did. Be definite about your dates and plans, because what units don't want is they don't want people going, oh well, yeah, I'll see, maybe that'll work. Be very definite about what you want before you contact them, and be prepared to have your supervisor or referee proactively contact the unit to vouch support for you. Try and know somebody who's been there before, who's able to vouch for you as well. And the whole appointment system in Australia is very, very different. And be clear about what your plans and objectives are for what you want to achieve from your year. A lot of this passes through word of mouth and through specialty groups and people who know somebody who's been there, or people who know somebody who's been to a particular unit. And unfortunately, despite everything else, that is the way that things work. Approaching the unit head directly is a really good idea, and actually making contact proactively and seeking out what you can offer for them is always quite good. Believe it or not, some places in Australia still play by the rules and still formally advertise jobs. But even in those jobs that have been formally advertised, they will usually have had contact from somebody and have a preferred candidate before the adverts go out. Australian hospitals are very canny that nothing gets advertised until they know who they're appointing. And often the jobs are not advertised at all, or even formally interviewed. So the whole sort of process of making contact with people is very, very important. It sounds a very simple and basic thing, but make sure your CV is up to date and tailored to the position that you want to do. We've had CVs submitted to our unit which we kind of looked at and went, is this person actually a vascular trainee? And it's amazing how simple that little thing is, and how much you can sell yourself through what you do in your CV. It's important also to appreciate what the unit wants and selling yourself towards what they want. A cover letter works well in terms of stating what you want to achieve and what you can offer for the unit. And again, phone calls and personal contact makes very good sense. From the unit's point of view, in terms of deciding who they want somebody who's going to keep the patient safe on the ward and run the ward effectively with the most minimal disruption to the consultants. They want somebody who's going to want to organise and supervise the junior staff and can be trusted to operate with limited supervision. Good communication skills and team playing are essential whenever you're working in an environment with a 1 and 2, 1 and 3, 1 and 4 on call. And it's important to be prepared to go that extra mile to achieve that. But ultimately, we want somebody who's also trainable and has shown some degree of success within their career, who's actually going to make use of their time in Australia and is going to come back and promote the unit to other people and encourage other people to go back. So there's a mix of things that you have to get right there. And it's actually never too early to start looking for these jobs. And I say a minimum of 1 year ahead, ideally 2 years ahead of when you're looking to go, because we've had applicants in our unit up to and including 2019 already. And often most units will have had people approach them at various stages and will have a plan penciled in many years in advance. So be organised. So once you've actually been able to secure a position, then you've got to start dealing with these organisations, which is where the frustrations begin. The Australians love their bureaucracy and they love different terminology. So APRA is also called the Medical Board of Australia, and they use the terms interchangeably at various stages just to confuse you. The Australian Medical Council also has a role to play, but nobody's quite sure what it is. So when you look at how you get there and what you do, if you've been trained in a UK medical school and completed your internship in the UK, you go through the competent authority pathway, and it looks like there's a fairly streamlined process there. You secure your employment officer, you apply to the AMC for primary source verification, you apply to the medical board for provisional registration, you complete your 12-month supervised practice, and then you get your general registration. Dead easy. Until you then start looking at what that actually involves. And unfortunately, they also change the processes about every 3 to 6 months without telling anyone. And usually in the middle of your application process, they decide that actually what they had before wasn't quite adequate, so they've decided to change it and add in even more bureaucracy. So the AMC controls this EICS verification through EPIC, which is through the ECFMG, and lots of other acronyms that you start to get muddled in your head. And the whole process starts with the one on your left-hand side. And that's often one of the rate limiting steps, is getting your primary medical degree recognised by Australia to be able to work in Australia. You then apply for the competent authority pathway, which is the pathway on your right. And you can see that that then involves a significant number of steps. So if I go back to that, you can see how this rapidly expands out to a large number of steps that you then need to complete. And what's important to realise is that all of these take a significant amount of time, because they also don't do an awful lot electronically. They require original signatures on things, and everything has to be done by post. So they are very fond of moving the goalposts every time you think you've got there. There's lots of paperwork required. You're still required to provide proof of English language. I'll go into that a bit more in a minute. You're required to have all of your documents signed by a notary public, which has to be the same notary public who also signed your application forms. So you'll often end up running back and forward to solicitors to have things signed and verified. And simple things like having your CV in the correct prescribed format as per the APRA regulations can actually hold up your application by several months if you don't get it right the first time. Never assume that you have everything completed. And until you get the letter from APRA telling you that you have your provisional registration, don't assume that they won't come back to you looking for more information. It's a very stressful process. It is very time consuming, and you can never be too organised about getting this started. It is stressful and frustrating, and certainly the period whenever I was going out for my fellowships, the month before I went was probably one of the most stressful in my life. But what's important to realise is don't fight the system. The more you try and fight it, the more you get antagonised by the system, the more it will frustrate you, wind you up, and will slow you down. The system is what it is, and you've just got to jump through those hoops and get over the hurdles. The visa is sponsored by your employing hospital, and actually it's the most straightforward of all of the processes. The APRA and AMC processes are actually the more difficult. So the online form and digital uploads for the visa process is actually pretty straightforward, and that comes through pretty quickly once you have the other things in place. But as with everything, you have to have your EPIC primary source verification done before you can apply to APRA. You then have to have your APRA registration through before you can finally get your visa. So you have to be very conscious of the timelines for each of those. And whilst a little bit of it can be done in parallel, they generally exist one step after the other. So as I say, the rate limiting steps are the EPIC or EICS verification. The proof of English language was one of those things that was incredibly frustrating. I tried to fight the system. I sent them my GCSE and A-level results where I'd done English language with my gradings. That wasn't enough. What they actually wanted from me was a letter from my secondary school confirming the dates that I'd attended and stating that I'd been taught in the English language. So I had to go back to BRA and get them to write me a letter, which just sounded like the most ludicrous thing in the world to me. But that was all they would accept from me. The APRA assessment, as I said, can take some time before it's formally assessed. And be conscious that postal times are actually an awful lot longer than what you think. And using registered mail and express delivery is actually becomes quite important. Australia Post are not famed for their expediency, and it can often take quite a while for letters from the UK to reach Australia, sometimes over 2 weeks. It's also important that if you are going during your training that you do apply to the Deanery for out-of-programme training. And it's vital that you speak to the head of school early, inform them of your intentions and what you're looking to do, and making your plans clear and discussing your options clearly at an early stage. You also need to have this approved by the JCST and GMC before you depart on your out-of-programme training if you do want to count it as part of your training period. So how do you stay there? Well, this is the process that I had to go through. So if you do want to ultimately make that jump and stay in Australia, you need to undergo a college specialist assessment, which is an expensive process costing around $35,000. It's coordinated through the Royal Australasian College of Surgeons, and it is frustratingly slow. The actual time point from submitting my paperwork to having my assessment done was about 8 months. It is a paper-based assessment, and you need to provide evidence of absolutely everything that you have ever done in your job. So that includes a job description for every job that you have done, evidence of your assessments from every job, evidence of your logbook from every job, evidence of the exams that you've done, what the course and syllabus was for the exams that you did, and what the structure and content of the exams was. So actually having an excellent portfolio and good record keeping is essential. And that picture is actually the pile of papers that I submitted to the college as part of my assessment process. So you can imagine how long it takes to actually compile all of that stuff that is required. You then have to undergo an IMG interview with the college, which is one of those interviews that you never come out of feeling happy or satisfied, because unlike many other interviews which are about you telling them what you've done well and how good you are, what they do is they pick holes in absolutely everything that you have done. They look to find the deficiencies, they look to find where you haven't done something compared to an Australian trainee, and you come out of it feeling absolutely rubbish. And as I said, it probes the content of your exams and what exactly you've done, which is particularly relevant for subspecialty status. The vast majority of people are given 2 years of supervised practice, which essentially means that you can't work as a consultant in Australia until you've completed those 2 years. That's not strictly true, because often there are ways around that within the hospitals where you work at consultant level but under nominal supervision, but you're not paid as a consultant while you're doing this. It costs you about $8,000 per year in order to for the privilege of having them supervise you. They have minimum logbook requirements, and you have to participate in their logbook. And there are very specialty specific criteria. So for example, in vascular, I had to complete a minimum number of endovascular procedures and 100 hours of ultrasound training before I could sit the Australasian Fellowship exam, which is an $8,000 approximately entry fee per attempt. The fellowship exam is very different to the fellowship exam here. And the vast majority of specialties use long answer essay questions, but may also include short answer and MCQ type questions. The last time I'd written a long answer question was at medical school, probably at second MB. There are clinicals of long and short cases and multiple vivas. And I've given there sort of a breakdown of what my exam in vascular included. And you can see that it was actually a fairly intense couple of days worth of examining. And I have to say that from having sat the English Fellowship, the European Fellowship and the Australasian Fellowship, that the Australasian Fellowship examined my specialty in more breadth and more depth than what I was ever examined anywhere else. It's also important to realise that there is a high failure rate at first sitting of the exam among IMGs. And this is a harsh reality of life over in Australia. Whether that's fair or not, or whether it reflects your performance or not, it is what it is. And it's one of those unseen things and unsaid things that there is a high failure rate among IMGs. But you do get to pass the exam eventually. As I said, I've now been through the 3 fellowship systems, and I'm probably the most underskilled and overqualified vascular surgeon working in Australia. But it's amazing how the different systems adapt and are approaching things at a very different level. My viva was asking questions such as the course and anatomical relations of the facial artery and the embryology of the diaphragm. So it examines at a depth that really I had no concept of whenever I was entering into it. You've then got to find yourself a job, and it is amazing, what can happen in terms of jobs. For people coming from the UK, there's a 10-year moratorium on private practice, and public jobs are harder to get now than what they were before. What's also clear is that the Australian medical schools are now outputting more doctors than they ever had before, and the opportunities are rapidly disappearing in Australia for people to come across from the UK. But it does largely depend on the state and location where you are, and what you're prepared to do and where you're prepared to accept working. The other aspect is that once you do make that decision to stay, you have to have a visa which allows you to stay. And the 457 visa which you go on for your fellowship period isn't enough to allow you to stay permanently. It'll allow you to stay for up to 4 years, but you have to start thinking of the other plans, which can either be having your employer sponsor you, getting regional sponsorship, or applying yourself through skilled migration, which is actually probably the most useful thing to do. But you need to have APRA registration and a college assessment in order to be able to apply for skilled migration. So how did I get my job? Well, I visited Flinders Medical Centre in 2009 to arrange a fellowship, and I'd actually visited both the Royal Adelaide and Flinders at the same time, and arranged both my pre and post ASiT fellowships to be in the same city, where I would go between the two units, and told both units that my intention was to stay in Australia at that time. I told them what I could offer, what my background was, and what I wanted to achieve within my future career. I worked hard during my fellowships, and I tried to make myself somewhat indispensable. What was interesting was that during that initial visit, sitting down over a cup of coffee, overlooking the Botanic Gardens, and chatting to Ewan Macaulay at the Royal Adelaide, and then going up to Flinders and speaking to Ian Spark, was whenever I told them what my intentions were and what my thought was and where my direction of travel was going, at that stage both of them told me that they would likely have jobs available for me at that time. I didn't really believe them, but as it turns out, I've actually been offered 3 jobs in Australia, all in Adelaide, and in some ways it's ended up being the longest job interview on record, because I've actually been getting assessed since that initial period of interview. I call it an interview, it was a cup of coffee and a chat, but essentially that was my interview for my fellowship positions, and I've never had a formal interview for anything subsequent to that. Jobs can be created out of thin air, and in fact my job has been created at Flinders Medical Centre by my colleagues all dropping part of their own salary and dropping part of their own time, because they wanted to keep me as part of their unit, which is a very privileged position to be in. But it's amazing how things can be manipulated within Australia that doesn't seem to be able to happen here in the UK at the minute. And the employment legislation in Oz probably pretends to be similar to what it is here in Northern Ireland, but in reality it's very, very different. And you've got to trust people with what they tell you, and if they tell you that they will sort things out and that there will be positions, trust them on it, and once you've got through the process, there are things there. Particularly with fellowship positions, it can seem very weird that you don't formally apply for a job, that you don't formally interview, and you kind of expect that everything's going to fall apart at some stage. But the reality is that the fellow positions are very important to the units, and they make sure that these things do happen. So would I bother coming back? Well, currently I have the skills which I've developed, which have been able to deliver all aspects of my patient's care. I have free access to all of the resources I need. I've got good support and working relationships and the ability to innovate within my practice. And there is the aspect of the lifestyle, the bank holiday weekend weather, the travel, and the fact that I don't have to deal with this person. And this is less than 20 minutes from my hospital, so essentially I can be on call from here, and have been on call from here, at my friend's winery, and still have access to the city and to the hospital. Thank you.
you all found that very inspiring at the start, and then, oh my goodness, that's a lot of paperwork to get through. I'd just like to open the floor up to any questions that anybody would like to ask.